It's a pleasure to be here. And before we even go on, I would love to talk a little bit about the National Federation of Families. And I am the project director of the National Family Support Technical Assistance Center, which is led by the National Federation of Families. So for those who aren't familiar with what and who the National Federation of Families is, we're a nationally family-run organization, and we serve as the voice for families. And a family-run organization is an organization that has 51% or better board members who have lived experience as family members. And a family member is someone who's helped be either the caretaker, and you don't have to be biological, but the identified family member and help another family member kind of navigate the systems. We all have lived experience, as I said. We always advocate for families, and we're a champion for social justice. And you will see that we have an evergreen campaign that talks a lot about social justice, particularly for the month of May, which is Mental Health Acceptance Month. We always promote family peer support. We believe families are experts, and we accept, advocate, and act. And today we're really going to focus on the family peer support, but Dana will get to that a little later. Next page. Now, I mentioned NASTAC is led by the National Federation of Families, and NASTAC is the National Family Support Technical Assistance Center. And we are truly honored to be the first family center of excellence funded by SAMHSA. We actually provide information, training, resources, workforce development, and technical assistance. So if you visit our NASTAC.org pages at any time, you will be able to access many, many resources and online events. NASTAC's primary goals and objectives are we inform the workforce, and our workforce includes a broad aspect of our community, our family support community, our family-run organizations, our family peer specialists. We support youth peer specialists and also the adult recovery workforce. What our goal is to increase access to resources. And I had mentioned that if you go to NASTAC.org and you go under our resources, you'll have an access to many resources that we created during the course of this grant, but also we have a large array of additional resources in our resource library from all our partners. We provide family engagement and support training. And every month, from the month of September to June, we take a break in July and August to recalibrate. But from September to June, we have at least 3 events going on each month. Next slide, please. So we'd like to know all our work and what we promote and what we hope to educate and train on is being person-centered. So how person-centered is your work? Do you treat people with dignity and respect? I have a feeling that if you're here in this presentation and listening, I would hope that you would. We encourage growth out of a person's existing strengths and talents. And we always really go to that system of care thought. What makes you tick? What are the things you're good at? What are your strengths? We want to know that before anything else. And we support a person to engage in their community and to also build meaningful relationships. We listen to and take action based on what a person says there are about their goals. And we make strong efforts to understand the person what's unique about them, what's exciting about them. And we learn what the person truly thinks is the most important thing to them when planning their own goals. So we always look at person-centered goals. What do you think will work? And we do not believe on throwing our beliefs or our goals for a family onto them. Next slide, please. So how family driven is your work? Well, we hope that families have a primary decision-making role for their own children and their loved ones. Families know their children, their loved ones best. I know as a parent, I have three daughters, and all of them have mental health diagnoses. But I also know when just hearing their voice when they call, they're all adult children now. But if a word, even the word mom, I can go, oh, she's having a bad day, or uh-oh, she's having a great day. This is great. So we know our children. And the lived voice, we are also the lived experience voice and heard at all levels. Families know what works for them at all three levels, at the personal direct service level, at the community level, and also at the national level. Dana, is this yours, Dana?
Nope, you were gonna do this one.
All right, I'm sorry. And of course, we support caregivers and we ask families what would best work for you. And that's being person centered. And we always have having someone listen to your entire stories. Families say, I need to tell my story. And if you've worked with families before, sometimes you'll hear a family tell their story over and over again. Why do you think that happens? It's been my experiences, they feel like they haven't been heard and acknowledged about their story. So we really have to listen and acknowledge their story before we can do anything. Having someone to walk me through how to access a service or who to contact to get help for me and my family member, having someone navigate the system with them and walk side by side is so valuable to families. Meeting a peer support person that could relate to my situation and meet me where I was. Having someone to advocate for me early on or teach me how to advocate for myself. Sometimes families and even individuals need a person, a peer that has walked the walk next to them to kind of lead by example and then hand over the reins and to give them that encouragement to be that cheerleader, to coach, and developing plans that reflect my family's priorities and culture. And that's very respectful. We heard the acknowledgement of land that Ingrid had said at the beginning of this presentation. We need to acknowledge individuals' cultures and priorities. Working with someone who gave me choices about how to address our needs. Now, sometimes we need paid individuals and sometimes we need natural supported individuals, but there's always someone there to help address needs of the family. And learning what a family-centered, person-centered planning process looks like when creating a plan for my family or individual. And I really think that a lot of us and a lot of organizations say, oh yeah, we have a person-centered, family-driven plan. But if you go into it on day one without even meeting the family, do you really think you understand the family, or the family's going to be open enough to tell you what their real hopes and dreams are? An authentic, family-driven, person-centered planning process takes a couple of days to get to know the individual, to have both the person who's going to help with the plan and the family or individual to relax and be able to feel that trust before that real, authentic, person-centered planning begins. So families live expertise. As I told you, I have three daughters, all with mental health issues. One is experiencing a crisis at the moment. So if the phone rings and I turn a little pale and have to leave to answer it, please understand I'm being a parent. But those are my lived experiences, and we have lived expertise through the whole age range. You never stop being a parent from the time you have a child who's 1 month old to a child that's 65. So that is that lived expertise that I can share with someone else when I'm being a family peer specialist. And many families have to navigate school mental health systems for the first time. And you know that that could be a very intimidating process. But if you have someone walking side by side with you, and they are not judging you and they're not blaming you and they're empowering you, you feel more confident and you can get that help that you know would support your family best. Families often know, they absolutely know what works best for their child.
Thank you so much, Gail. So Gail and I have been talking to you about families' lived expertise and how beneficial it can be for someone who has that shared lived expertise to guide that family along. And that person is called a family peer specialist. So we know that most of you here in the audience are school mental health providers or otherwise related to the education system. So this is a person that would be outside of the school that you could let families know is available to support them. And we hope that educating you about what a family peer specialist is will help you to feel like you have an extra resource out there that you can connect family members to. As Gail already mentioned, a family peer specialist is that parent, family member, or caregiver who has that lived experience as a primary caregiver for someone experiencing mental health or substance use challenges. And that they use that lived experience and expertise to help the family member understand how to advocate for their own child's well-being and best practices in various systems. So family peer specialists are really there as a person who has walked in those shoes and can then now help explain certain things to the parent and be there with them to help them better understand everything that's happening in this complex school mental health system. So when you get these slides, you'll see a link to the National Federations of Families website. I'll put that in the chat as well. And go to our affiliates page, and you can find affiliates who can connect you with family peer specialists across the US. Family peer specialists, they can connect families to each other, which helps reduce isolation. When they share their own experiences, that helps normalize lived experience. A lot of times when a child has a new diagnosis, a family member can feel like they're like a bit of shame or feel like they as parents are blamed. And we've done lots of different listening sessions, and research has shown that families who do navigate school mental health systems often do feel blamed by teachers and other educators, and sometimes even school mental health professionals themselves. So hearing another family's lived experience helps them feel like what they're going through is much more normal. Family peer specialists also really do help encourage resiliency by giving them specific strategies, as well as giving them hope that recovery is possible because they share their own experiences. And family peers offer support. They help them connect with resources and providers. They help walk alongside them through various systems. They even give them self-care and family well-being strategies, and sometimes very concrete supports like connecting them to housing or childcare. So family peer specialists are a great resource for school mental health staff to understand, that can really help them work together with the family in a more effective way. But let's get into what school mental health staff themselves can do to have more person-centered, family-driven partnerships. The first and most important thing you can do is think about how you're treating families. Every single person deserves dignity, respect, and compassion. And families who are navigating a mental health crisis or trying after years and years of having difficulty at school to get their children services that they deserve, they might have anger. They might have a distrust of the school mental health system, but they deserve the same dignity, respect, and compassion that every other person who walks through that door gets. And patience is really, really important too, because those families, like Gail said, sometimes one of the most important things they need is to just let their story be heard. And spending a little more time to allow that to happen can actually save you time in the future because you're all more on the same page and able to work together as a team. Another great tip for partnering with families is to explain all the lingo. We want to make sure that any of those acronyms, IEP, 504, that's being explained what that is. We use a lot of shorthand in school mental health, so just really making sure that families understand that. Some families are not going to say, hey, I didn't really get what that means. So doing a check-in. Do you understand what that means? Or is there any more information I can provide to help you better understand something like that? It's also really helpful at the very beginning of a relationship with a family. If you know that this is going to be an interaction where you're partnering together to create a goal and different activities that you are going to do both at school and at home, that you're very, very open and upfront about what role the family member plays, what role the teacher plays, what role the special education provider plays, what role the school psychologist plays, and who has what responsibilities. And a lot of times families want things done right now. They have this new diagnosis and they want these services and these things and don't necessarily understand the bureaucracy that school mental health staff have to go through and the fact that some timelines just can't be sped up. So it's really important to also explain the timelines of when different things happen, when different meetings have to take place, and also explaining all of the paperwork that is required and trying to minimize doing for the family as much as possible and do things with the family so that it truly does feel like a partnership. We also want to make sure that we're thinking about the fact that, as Gail mentioned, families are the experts when it comes to their child. They know what has worked historically. They know what has not worked, both at home and at school. We always want to center the family's goals and the child's, when possible, bringing that child into these IEP meetings as well, so that the child gets to have a say in what their goals is. Anytime that someone is involved in creating goals and the steps to get to those goals, they have more agency and it's more likely that the goals will be reached. And there are times when a parent knows so much more than a school mental health professional about their child's specific diagnosis. Sometimes children have gotten a diagnosis at the age of 3 or 4, and that parent has gone to seminars and read books and is in support groups with other family members whose child has that diagnosis. So often family members can be a vital and valuable resource to school mental health staff. And as a reminder, school mental health staff are almost never allowed to give a diagnosis unless that is a school psychologist who has done a diagnostic test, but usually that's not even done at the school. So it's very important for school mental health staff to respect their specific roles and responsibilities there. And when we're thinking about interventions, it's really, really helpful to get on the same page at school and home, because if it's an intervention that needs to be reinforced to really change a specific behavior, if that's being held to very strictly at school and then the moment they get home, that goes out the door, then you're going to be restarting every single day when the child comes back to school. So trying very hard to collaborate on interventions. And sometimes school mental health staff have this really fabulous evidence-based practice that they want to try. They're so excited for it. But for whatever reason, the family just cannot make that work. So being flexible as well, making small adaptations and changes to make it work for the family is really, really important. And then, as we have been saying since we started this presentation, for everything that you're doing with planning, take that person-centered, family-driven approach. Instead of handing families an already completed document that talks about what the child's goal is, where they're going to be in 2 months, where they're going to be in 4 months, don't do that. Sit down and come up with that together. That's going to give so much more buy-in. So now let's take a look at a course that NAFSTAC collaborated on with Boston University. This is a really great course that teaches anyone who works with families in behavioral health how to best partner with families. So Ingrid just put the link to the course in the chat. Feel free to go to that link and follow along with me. We're going to talk about a couple of resources that you can download as we go through the course. So there are 6 lessons to this course. We start out talking about the importance of being family-centered and person-centered, which Gail and I already talked about. We also feel really strongly that specific language that we use changes the tone of a partnership. So we try really hard to take an anti-patriarchal stance to language in this course. So we've given a few definitions of really the most important terms. And then we've talked about a few terms that we don't use in this course and why. So we don't use care. We don't use empower or empowerment. We don't use helper or helping, and we don't use patient. So there's a little bit more information about that if you go to the course itself. And then we have 6 different lessons. This is the first one about facing personal and professional attitudes. So this is really about understanding your biases and what you can do to overcome those biases. So the course has helpful resources like videos that talk about more about specific subjects like implicit bias. We also hear some stories from families themselves about their experience of discrimination related to mental health challenges. And we also do give some really great theories and ideas. These are some definitions of different types of biases. And throughout the course, you'll find these practice pauses, which invite you to sit and think about how these concepts affect your own life. So we're not going to give you enough time to actually take the course right here and then. It's about a 4 to 6 hour course, but we hope giving you a little bit of a tour of the course will inspire you to explore it and also think about some of the things that are needed for effective family partnerships. So the next part is about judgment. It's about language, using person first language. We have some really great tools. NAFSTAC collaborated with the other centers of excellence, one for African American behavioral health, one for LGBTQ plus behavioral health, and one for behavioral health disparities in aging. And we have a guide that shows you it shows you how to move towards person-centered language. So for example, instead of saying suffering from a mental illness, we say experience or living with a mental health challenge. Or instead of saying drug abuser, alcoholic, addict, or substance abuse, we say person who experienced substance use challenges. There are lots more examples of that. And then there's some examples for the African American population. Instead of saying colored, Negro, or Afro-American, African American. And some aging examples, instead of seniors, elderly, aging dependents, we can say older people, and just say we and us. And then finally, the LGBTQ plus, instead of saying lifestyle, choice, or preference, it's just sexual orientation or gender identity. It's not a choice. So that's one resource that we think you might benefit from. And then another one that we have, oh, I think it's in a different section, sorry. So the next lesson is about what Gail and I both talked of, that family expertise, really trying to acknowledge that families have that expertise and it's valuable in these behavioral health relationships. And also their identities. That's where the cultural piece comes in. So we want to first start to understand who the family is. So we want to think about families' cultures, and you don't have to be an expert in every single culture. That would be impossible. So we just want to ask questions and be curious and offer behavioral health support that aligns with their cultures. So we want to make sure that we're asking what their preferences are, paying attention, and really making sure that we're in conversation with them constantly, trying to learn more. And we've got this great checklist that we would also love to show you. And we thought we could take just a minute to try and take this. So I'm going to put that in the chat. So this is a really great tool for anyone who works with families. It's called the Family Partnership Checklist. And it has a few different sections. There's one about beliefs and biases. We've got one about effective communication, supporting families' understanding, best practices for family partnership, and if you use telehealth, best practices via telehealth. So there's these different sections, and you get to rate yourself on how well you practice these different best practices. So let's just take about 2 minutes to read through the first section on beliefs and biases. And once you download it, you'll be able to click in each of these boxes, and you can just answer those questions. I'll give you about 2 minutes. If you're finishing up the checklist, feel free to weigh in on the chat about how that felt. All right, we'll move on, but we do encourage you to download that and take the full checklist at some point. And there's tons of resources on the nafstac.org website to take some trainings on any of these topics. MHTTC has a lot of great trainings as well. What else? So this last part of this lesson is about cultural congruence. And so according to Dr. Marshall Linehan, there are 5 core components of validating a family. And validating helps us observe, by observing, reflecting, naming the unspoken. So sometimes in certain cultures, families have thoughts and feelings that they aren't actually saying out loud, and you have to explore a little bit. Acknowledging what the person is saying and responding genuinely. So nowhere there is there anything about having to be an expert in that person's culture. It's just about having conversation and communicating. There are a few great methods that we share in here, like the LEAP method, which helps become more person-centered. That's listening, empathizing, agreeing, and then partnering with the person that you're trying to plan with. And then I'm going to pass it over to Gail to go through the rest of the course. Hope you're on mute.
Thank you, Dana. So we can move on to identifying solutions to conflict. Now, I know particularly we know how difficult it is sometimes to work in school systems, and how sometimes we can come into conflicts with the folks we're serving, particularly parents. So there are some really good cues and ideas of how we can reduce that. And if you see that, we have focusing on commonalities. Always, That's a bright thing about being a family peer. It's that commonality. Same with when we're working in a school system and really focusing on the similarities with the parents and the families you're working with. And of course, everyone is in there to make sure that young person, that student, is there to succeed. So that's a definite great commonality. And to really clarify the roles of each other and to understand that we all have some responsibilities and we all have expertise, whether it's lived experience or personal or professional experience. The practice pauses are really, really good here. And if you read them and if you can go through the scenario, you would really see some really helpful hints. And of course, with all conflicts, there comes differences. And sometimes we have to work those out. So we really have to acknowledge each other's differences and really listen and empathize, and also sometimes agree to disagree. But together, to be engaged, both of us, we need to fully partner. And we steer away from the word engaged because we can engage families all you want, or we can engage staff all you want. But if we're not partnering with individuals, it's not a real engagement. And we have some great videos here that will also help clarify things. Go to the next one. Now, repairing ruptures. Sometimes a conflict it can't not happen. So how do we go past that and reestablish that trust and that working relationship? So of course we have an area here that talks about acknowledging the rupture. And your person, it's not a failure to say, I see where I contributed it to this and the impact of it. An apology goes a long, long way. Just saying, yeah, I messed up and I'm really sorry. Or making room for the family to share that impact. And of course, we have to move past those ruptures and really recreate that trusting relationship because, of course, the goal is having that young person, that student, successfully navigate through the school and to become a, to get his high school diploma or to become a degreed individual and have a really good future. We can go on to the next piece. And letting go. Here's an interesting piece because I know I was a guidance counselor for many, many years. And after that, I worked as a care coordinator, a supervisor, a program manager. And you feel some ownership of those families. But we have to realize that we have to share that and we have to let go of that feeling like they're doing so good and I'm helping them. There are other people in the field. There are other families that are in the field that all can support a family. So we have to practice that zone of usefulness and always maintaining and staying effective in our own zone. So we have to encourage the families and encourage the individual to be autonomous. We have to be realistic in our goals. We have to be interactive, and we really, really have to be open to change and be change oriented. And then, of course, we have in this module some more practice pauses to really make you think and talk. And remember, this module, the whole training is open to anyone who works with families or who wants to really create a true partnership. So please, you could share this module with your colleagues. You can give it out to the community. This is just really was developed so we could have a better working relationship and conversation and support and partnership with families. You know, we went by this, and Dana, you don't have to go back, but there was something in there that caught my eye and I forgot to mention it. It talks about embracing silence. Sometimes if there's silence in the room and you You don't need to always have to fill it. You can sit back for a beat. And sometimes that will bring families or any individual to then have a beat of their own and maybe speak up and share something that they wouldn't have felt comfortable enough to share if we were going through steps and filling in that space. And of course, sharing power, something that a lot of us, including myself, have a hard time doing, understanding that teamwork is power. And, making families comfortable and meeting where they feel a good location and time is. And that I know it isn't always useful, or you don't have that ability, but it is a really, really good way of developing those true partnerships. And we go through different steps, and I'm sure a lot of you will recognize a lot of pieces. And the hints that this module provides will help you, give you a more expanded knowledge on how to partner with families. And yielding to outside supports. And here's where family peer specialists come. Now, there are a lot of communities across the country that have family peer specialists embedded in the school systems to really work with the families. They also, a lot of them have youth peers as well. And this talks about being open to, if a parent says, I want to take my family peer specialist to the IEP meeting, or can I include this person as my peer specialist in our conversation, to actually yield to understanding that this is a support person. And again, best practice would have them family peer specialist embedded in every school. And someday maybe we'll get there. And we also have linking to meaningful resources, all the resources that Dana talked to you, and we have some more here that you can link up and connect to. We have a list here. Boston University was so gracious in supplying a very extensive list. And congratulations if you do the whole course. And I am drawing a blank on how long it would take. Dana, do you remember how long it takes to actually go through the entire course?
Yeah, we did some feedback surveys during our pilot session, and most people said they spent between 2 and 4 hours for the course. You do get 6 credit hours to take the course because there's 6 lessons that we designed to be approximately an hour if you do take your time doing all of those reflection activities and watching the videos thoroughly. So, yeah.
Yeah. And we're open to any questions you may have. So please, if you want to take your mics off or put questions in the chat, we're here to help.
And Ingrid has sent me a couple of questions that came privately to her, so I can read those out loud and we can answer those, Gail.
Okay.
So we had one question about training to become a family peer specialist. This person is in Northern Nevada and had never heard of this. They're just now embracing peer support specialists for adults who have substance use challenges.
Well, it's funny you should ask. Nevada has a very extensive family-run organization. And if you go to the map that Dana showed you and go to Nevada, you'll find the local family-run organization. Best practice is to get the family peer specialist training in your state by the family-run organization. The National Federation of Families has over 100 affiliates across the country. And all affiliates are family-run organizations, which means they are families with lived experience supporting other families. Another way, though, starting on June 1st, which is only 2 weeks from now, will be another curriculum, much like the one you just saw from BU. NASTAC has developed and is about to go live on June 1st on a family peer specialist one-on-one course. And it is a bit longer. We estimate it takes 5 to 8 hours to complete, but you can do it online on your own. on a Saturday afternoon, a couple hours here and there until you finish it. But you may take that training, and then you can apply those 8 hours to a national certification at the National Federation of Families.
We got another question. Someone asked if the questionnaire the checklist that we showed, it's for the workforce and not the family. And that's correct. That checklist that we showed is for anyone who works with families in behavioral health. That's not to say that we don't have resources for families. If you go to nafstac.org and you go to the resource page, we have a lot of resources that are just for families. So school mental health staff would benefit from looking at that resource library that Gail spoke about, where you can search by topic to find exactly what you need. And a lot of those resources are family driven. We also have a toolkit for families that breaks down different resources by category. And so anyone can go to that toolkit as well and find specific resources about different diagnoses or about navigating different systems, about crisis planning, lots of really great stuff. So make sure to check out that NAFSTAC resource page, not only for yourself as a mental health professional, but also for families as well. And the National Federation of Families also has a resource page. So we just have so many resources for you. You can also request, Gail mentioned at the top of the presentation, technical assistance. And if you're here at the MHTTC, you probably know what technical assistance is, but just in case you don't, if you are working with a family member and you need some kind of support where you're looking for a specific resource that would be good for families, you can also request technical assistance through NAFSTAC, and we can help connect you to that resource. So that's always open as well. Or you can bring us in to do trainings for your school staff to talk about family partnership, because all of the things that Gail and I talked about today are great in school mental health, and a lot of those partnership techniques translate to the classroom as well. So educators would benefit from all of this information too. Are there more questions?
Well, certainly, if you visit our websites, you'll be able to get so many resources. And as Dana said, our technical assistance, we can design to be specific for your particular question. So always remember, if you think it's outside of the realm of what we can do, ask us anyways, because this is a center of excellence and we're giving that flexibility to actually support you and your particular individual needs.
And we didn't go over it when we looked at the course because we talked about person-centeredness so much at the beginning of our presentation. But in this partnership course, there are a lot of really valuable tools for you to do person-centered planning. There are planning worksheets that you can print off and fill in with families, and that can just give you a framework for how to do person-centered planning. But there are lots of other ways to do it as well. And in that toolkit that I mentioned, there's even more resources about person-centered planning. So we really encourage you to check those out too. Oh, great, Nicole. That's so wonderful. Thanks for being a family resource navigator. Yes, these will be great resources, and please share them with other family resource navigators.
Oh, absolutely. Nicole, what state are you in? New Hampshire. Oh, one of my favorites. Nicole, I lived in New Hampshire for 20 years, and my two oldest children graduated from Pinkerton Academy in Derry. Please feel free to take your mic off and ask another question. We're here for a few minutes. Well, Nicole, NAMI New Hampshire has some really, really good resources. And since I know all about New Hampshire, UNH, the Institute on Disabilities, under Joanne Malloy, Dr. Joanne Malloy, has lots and lots of additional resources for school, mental health, and the community. University of New Hampshire in Durham. Oh, the Institute on Disabilities.
Yeah, that
Dr.
I went outside. It'll be easier, but I might lose service because again, New Hampshire.
If you go,
I got UNH and I got Joanne Malloy.
okay, now it's called the Institute on Disabilities. And there's a great program that
Great.
Joanne and I co-created years ago, and it's now nationwide.
Oh,
And
that's
it's
wonderful.
called Renew, RENEW.
Great. Okay. Perfect. Thank you so much. This is going to be so helpful. Thank you. Thank you.
You're welcome.
Well, I'm so grateful for all of this information and resources, and of course for your partnership. So thank you, Dana and Gail.
Absolutely. Should we share some of our upcoming events?
Please.
Gail, do you want to?
Oh, you want me to do it? Absolutely. As I mentioned at the top, we have 3 events every month. We have Family Connections, which is really geared to parents and caregivers. We have Office Hours, which Dana leads, and that is the workforce development piece. And of course, we have a general NASDAQ webinar. And this month, I think I mentioned we had Words Matter Wednesdays. And instead of just one webinar, we had 5 for Mental Health Acceptance Month. But we have a webinar that's really focused to the general community and family support community and workforce and families themselves.
And we also have a SAMHSA-sponsored webinar series that we're doing through the National Federation of Families. This year's topic is Person-Centered Family-Driven Mental Health and Substance Use Support, a Path Towards Equity. And when you get these slides, you'll already have 2 out of the 4 presentations in recordings. We had a wonderful presentation from SAMHSA's Office of Recovery alongside Dr. Stephen Lloyd and our Executive Director, Dr. Linda Gargan, about mental health and substance use overcoming challenges to access for families. And just at the beginning of this month, we had another great session with a panel of wonderful speakers from a lot of different organizations that were talking about person-centered language and the connection to driving equity for folks who have co-occurring challenges, both mental health and substance use. And we've got 2 more coming up that you can register for on July 9th. We'll be talking about how poverty is an equity issue for mental health and substance use prevention, crisis intervention, and recovery. And we've got some wonderful speakers from Appalachia there. And then on July 30th, we're partnering with NAMI to do a webinar about informal and formal family peer support, the impact and the evidence. So register for both of those. And then Gail mentioned, oh, go ahead.
Okay. And this is the curriculum I was talking about. If Nicole's still here, this is the curriculum for family peer specialists, and it'll be available on June 1st. And here's our contact information. And anytime you go to the website, there's Ask for TA button. You can get me that way too.
Follow us on social media. We're all over the place. So when you get this, go ahead and follow us. You'll get more resources, especially if you're looking for resources for families. We share a lot of those.
And most importantly, and I'm looking forward to this in November of this year, is our national conference. Our national conference. This is going to be is it the 35th year? I can't remember.
35th, yeah, 35th.
Our 35th annual conference. We get about just under 800 individuals and their families and educators and clinicians. And it's going to be in Orlando. And really, really a good hotel with a very reasonable hotel price. So if you're going to go, please make your reservations as soon as possible. And then after the conference, there's Disney World down the street.
That's a bonus. Thank you so much.
Yeah, that's what I think.
Thanks to everyone for joining today's session. Barring no other questions, again, I'm so grateful for all that's been shared here. Please visit the website shared and access the training and resources that the National Federation of Families provides regularly.